Hi, welcome back to my YouTube channel. This is Afshal Faisal. Today I'm going to talk about selective serotonin reuptake inhibitors or SSRIs, which are common antidepressants. So this video is for the students of psychology, but if someone else wants to watch this, they are welcome to watch this for information. But it has a lot of terms that are related to clinical psychology, so they might not understand it well. Anyway, let's get started. So what are SSRIs? SSRIs are selective serotonin reuptake inhibitors. In depression and in some other psychological disorders like OCD, for example, the psychiatrists, they prescribe selective serotonin reuptake inhibitors because the serotonin level, there's a deficiency in the serotonin level. So to increase the levels of serotonin, this drug is administered. This is a type of antidepressant. So the function is to block the serotonin reuptake by the presynaptic neurons, which increases the serotonin in the synaptic cleft, and which is effective in treating the depressive symptoms and the other symptoms that are caused by the deficiency of serotonin. And there are many salts like citalopram, escitalopram, which are predominantly used. How SSRIs are different from tricyclic antidepressants and which ones are better? SSRIs, their serotonin reuptake inhibition property is stronger. They don't possess the undesirable properties of tricyclics. They're less, there's less risk associated with their overdose, and they're not lethal as compared to tricyclics. So it means that SSRIs are better. And there are certain hypotheses about the pharmacologic and molecular mechanism of the action of the SSRIs. According to monoamine hypothesis of depression, in a depressed state, the serotonin may be deficient at presynaptic dendrites and in the synapses. Hence, the neuronal firing may be decreased. According to neurotransmitter receptor hypothesis, pre- and post-synaptic receptors may be upregulated. The receptors increase. If you look at this diagram, you can see two pictures. The first one is when we are not administering SSRI, and the second one is where we are administering SSRI. So you can see the serotonin molecules. You can see it labeled. And you can see that it's going upwards. It's being, there's a reuptake of these, which causes a deficiency. But when we administer SSRI, if you look in the second picture, you can see that reuptake is inhibited, which keeps the level of the serotonin optimum to control the symptoms of depression and other negative, other symptoms of psychological disorders. The SSRIs block the reuptake of serotonin into the presynaptic neuron. There's an increase in 5-HT, the serotonin receptors at the cell body area. Serotonin 5-HT increases in the dendrites of the serotonin neuron. There are serotonin receptors present there that have 5-HT1 pharmacology. One thing which is not very pleasant about these is that their therapeutic effects, the onset of the therapeutic effect is late, about 4 weeks, and before it starts working, there are side effects as well. So it's very important to educate the patients about this. Otherwise, they can stop taking them, before it starts working. There's an increased 5-HT at the 5-HT1A autoreceptors, which causes them to downregulate and become desensitized over time. When we keep on having this for a long time, we can become desensitized. When desensitization occurs, 5-HT cannot effectively inhibit its own release, which results in disinhibition of serotonin neuron. And also, SSRIs exert powerful disinhibition of serotonin release in all its pathways in the brain. And when it happens in the unwanted pathways, then there are side effects, of course. Side effects may be alleviated by the desensitization of the particular receptors. And there are some people who don't respond to SSRIs because increase in serotonin at particular synapses is required for drug to do its therapeutic actions, and if it doesn't, then it won't work. So new drugs can be made which possess the property of increasing serotonin at these synapses and at a faster rate than which may affect the may show the therapeutic actions faster. So this was all about the SSRIs today. Thank you for watching.